Good evening, everybody. I, on behalf of the Scientific Committee of EIZOC, welcome you all in today's evening for a very interesting topic for the postgraduates, and also all of us have to learn from Professor Vanti regarding tips for how to write this. Because in this ORPI program, this is Ophthalmic Residents of the Research and Publication Initiative Program. We want that all the residents should know how to write an article for the purpose of publishing in journal. Now, as we know, the residents start their research activities from selecting a thesis and then doing the research work and finally writing the thesis. Because all of us have done this in our postgraduate days in different ways, not to be mentioned. But we actually do not know what actually the tips how to write a good thesis. So today I think we will be very much enlightened with the tips that Professor Vanati is going to tell us. Now I request Dr. R.C. Meher, the President of EIZOC, to give his welcome address. Sir, you are muted, sir.
Esteemed ophthalmologists, good evening to you all. I heartily welcome you all to this EIZOC Ophthalmic Research and Publication Initiative Webinar Series 3. Previously, we have conducted 2 series on this topic, and this is the webinar Series 3. Today, the topic is simple tips on writing your thesis, and the speaker is Dr. M. Binati from Dr. RP Center of Ophthalmological Science. She is professor there. I extend warm welcome to her to this webinar. Along with this, I welcome our mentor, Dr. Chaitra Jaydev, Chief Coordinator, Professor BNR Subudhi, Chairman Scientific Committee EIZOC, Dr. Sabyasachi Patnaik, Secretary EIZOC, Dr. Swaraj Bhattacharya, and most welcome to our advisor, Dr. Ajit Babu Machi, moderator, Dr. Prafula Maharana, co-moderator, Dr. Chandana Chakrabarti, and I welcome also to all the panelists and discussants. Happy to see that our panelists and discussants are from different parts of EIZOC. All are taking parts in with zeal and enthusiasm and interest. This is definitely very helpful from all to all, in particular for residents, for writing their thesis, and for afterwards for publishing papers in journals. So friends, after welcoming you all again and giving a lot of thanks to you all for your participation, I hand over this to our Chairman Scientific Committee, Sabyasachi Patnaik. Thanking you all. Long live EIZOC.
Thank you, sir. Thank you very much. Now I request our Secretary, Swaraj Bhattacharya, to
Thank you, President. And good evening, everybody. From the EIZOC Secretariat, we are here again together for being a part of the webinar EIZOC Ophthalmic Research and Publication Initiative ORPI Webinar Series 3. ORPI will be giving us a guideline for the young generation to come up with a research and publication initiative, which in turn will improve the academic activities. And as a whole, with this type of programs, the bonding between the states of EIZOC will be tightened. Through EIZOC, Eastern India is gaining its position and repute in the National Ophthalmic Forum. Our Chairman Scientific Committee, Dr. Sabyasachi Patnaik, has framed the webinar in a meticulous way, supported by the Chief Coordinator, Dr. BNR Subudhi sir, and co-coordinator, Dr. Santosh Mahapatro. Today's speaker will be highlighting, as mentioned, about the simple tips for writing the thesis. We had with us galaxy of panelists who are the masters and authority in the field of scientific publication, led by Dr. Vibhuti Sinha, Dr. Suchitra Pariza, Dr. Sharmishta, Dr. Praghna Panda, Dr. Pushpa Kumari, Dr. Ruma Das, and Dr. Arup Deuri. Also, we had a good number of young ophthalmologists who will be the discussant of the program, and their interaction will surely make the program a successful one. We plan to do this type of webinar regularly, and in addition, our chairman ARC, Dr. YC Mehti, is also planning to have a few ARC activities this year. For your information, the midterm conference of the EIZOC will be held on 27th and 28th August at Port Blair. And those of us yet not registered, don't miss the great event and be a part of it. Thank you so much. And over to Chairman Scientific Committee, Dr. Shabushati.
So thank you very much, Dr. Suraj. Now I request our Chief Coordinator, Professor VNR Subudhi, to start the program.
Respected President EIZOC, my dear friend Secretary EIZOC, Dr. Sabisat Patnaik, Chairman Scientific Committee, and today's guest speaker, Dr. Nanki, our mentor, Dr. Chaitra Jaydev, and advisor, Dr. Ajit Babu. I welcome you all to this today's program of again Ophthalmic Research and Publication Initiative Series number 3. As already mentioned by all the speakers before me, I don't want to go to the details about the topic and the speaker, but only thing I got the honor to introduce the speaker to the audience today. Today's speaker is Professor M. Bharati. She is the Professor of Ophthalmology, ORPI Center, New Delhi. She has vast experience in research, and today I have the honor to read about her biodata. She is currently a faculty member at All India Institute of Medical Science, New Delhi since 2005, and working as a professor of ophthalmology, cornea, and ocular surface cataract and refractive services. She has completed her MBBS from Madras Medical College, Chennai, and thereafter completed MS and also residency training at AIIMS, New Delhi. She has completed an international clinical fellowship from Singapore National Eye Center in Advanced Laminar Transmission of Cornea. She had extensive work experience in the field of cornea and ocular surface, both medical and surgical, cataract and refractive surgery, limbal stem cell transplantation, and corneal transplant procedures. She has to her credit over 120 indexed international publications and contributed chapters of several international subspecialty books in her field of expertise. So out of these two important books, I would like to mention here the postgraduate ophthalmology and undergraduate ophthalmology for the students of MBBS and MS. She has contributed several national and international conferences as instructor, speaker, and made several scientific paper presentations. She has served as a joint treasurer and scientific committee member of AIOS, NARCHOM chairperson of Eye Bank Association of India, and governing council member of the Indian Society of Cornea and Cataract Refractive Surgeons. She has also been the past secretary of Delhi Ophthalmic Society and editor of Delhi Journal of Ophthalmology. So these few words, I welcome her to this today's webinar. Madam, next 1 hour is yours to interact with the postgraduate students, and of course a series of galaxy of panelists. I would say that they are all experts in their respective fields. So these are the people: Dr. Vibhuti Sinha, Dr. Sarmishta Behera, Dr. Pragya Panda, Dr. Pushpa Kumari, Dr. Sucheta Parija, Dr. Ruma Das, and Dr. Arup Deuri from different parts of different corners of EIZOC states. And of course, nothing moves without our discussions. Today's discussions, again, there are 15 discussions from different parts of the EIZOC state, from different medical colleges. I won't name them again because they are the same. Last time they are with us, so they will be continuing. And I hope they will have a lot of interest and lot of experience in these two webinars so that they can write their thesis very well. So these few words, I welcome you all to this webinar, not for the last, the viewers. Today's, I hope more than 100 viewers will be viewing this webinar today. So I stop here. Now I hand over mic to Dr. Chaitra Jaydev, our mentor of this program today. Before Dr. Vandi starts, because today I think no PG students are prepared till now. So I think straight away Dr. Bharati will start the lecture. So it's over to Dr. Chaitra.
So welcome again, all of you, to our third episode. Today we'll be actually having an extremely experienced speaker amongst us because she's guided several residents at RP Center for their thesis. So she's going to talk to us on the finer nuances of how to go about it, and how I think writing your thesis well is the first step in getting it to be published. So I think that's going to be a major stepping stone. And since this particular program, we are actually concentrating on how best you can learn to publish, I think it can't be a better beginning. Over to you, Dr. Vanati. I'm sure our kids are going to learn a lot from you.
Thank you, Dr. Chaitra, and thank you, Dr. Sabyachi, Dr. Subudhi for having me, and Dr. Meher and the entire team for having me on your prestigious platform. It's wonderful to see all the EIZOC executives and young ophthalmologists out here, and I'm sure that each and every one of you have vast experience in guiding your students towards successful thesis writing. So perhaps what I'm going to tell you over the next half an hour or so is just going to be a recap of what you already know, but with the emphasis on what is perhaps going to help you to take the research work which you have done, or perhaps for most of us, it's the first research work we have ever done in our career. So it's our earlier career research work, and we would all love to have it into a viewing portal so that many can benefit from reading and learning from what we have worked on. I hope I'm audible and I'm visible.
Yes.
So, yeah, so I have no financial interest in the mention of anything during the course of this talk. And this would be largely tailored to how to go about writing your thesis here. I think there are different aspects to writing your thesis. One is when you're writing it as a fulfillment of your master's degree. And two is when you are moving it a step ahead and transforming it into a manuscript for publishing in a journal. So these are the two arms at which we are looking at. And something which I would always like all the mentors who are leading the thesis work for their students is do have in your mind that when you are allotting a thesis topic, the main aim for giving a topic is to teach the student how to go about doing a particular research. They are fresh, young graduates, young undergraduates who are just joining us, and they do not have the wide experience in managing clinical cases as we do have. So our aim here is to teach them how to do a thesis in the right way and ethically. So if this is done, I think 90% of your job is well done. The part on writing your thesis well is something which the student needs to learn so that you're able to translate what you have done onto paper and to make it readable. So that's the next phase on thesis writing. Publishing would largely depend upon the exclusivity
Dr.
of the
Bharati,
topic.
sorry for interruption, Dr. Bharati. I think your
Yes.
slides are not moving.
I'm just going to start moving it. I'm just
Okay.
giving an introduction
madam.
here.
Okay.
So what they understand on going about it here. So the part 3 is if you want to translate it into publishing. So every journal would look for something new. And today I think there's a huge quotient of competitiveness when journals are looking at publishing work. So again, the exclusivity of the work is what is going to get your work across to the platform of publishing. So these are the aspects that one needs to understand when you're looking at the concerns in writing a thesis here. When you talk about postgraduate thesis writing, there are two ways. One is a master's, an MD or a MS thesis, and the other is a PhD dissertation here. So we would limit what we are talking about today to postgraduate thesis writing here. And a thesis is a document which is submitted in support of your candidature for your academic degree. So all students, something which I tell all of them is, don't look at it as a burden. Whenever you look at a work as a burden, you will not enjoy doing it. So enjoy doing your thesis work, and when you enjoy doing it, you will put your best and you will put forward more than your best in achieving to complete it, or in going on taking it across to completion here. So that's the important aspect, or the first most important aspect which I'll tell you is enjoy your thesis work, and remember, you're not doing it to make your thesis guide happy. Remember, it's part of the fulfillment of your master's degree. So a change in the view or the way you look at your thesis is going to go a long way in helping you to taking it forward here. So something which I always spend time with my thesis candidates when they first come to me, when they are allotted to me, is I tell them is how you go about writing your protocol. And a large part of the thesis guides is how you guide your student in writing your protocol here. A well-written protocol means that 50% of your thesis is already written. So by the time you're finishing, then your introduction, your research question, your research hypothesis, the justification for your thesis, the methodology, the literature review is already written. So which means is almost 50% of your thesis work is done enough. And in the 2 or 3 years or 1.5 years in which you're taking your thesis to completion, what you just need to do is add on the newer literature, which is just coming through the course as you're performing your methodology and you're carrying forward your analysis here. So pay a lot of attention to the way you're writing down your protocol. And it's largely the duty of the thesis guide to guide your candidates into a very proper, a very formatted thesis protocol writing here. Always remember that these are fresh students. They don't have our experience. So it is going to be our commitment and our responsibility to walk them or handhold them through this initial exercise here. So when you start writing your thesis, remember, it's a simple story. It's a simple story of your scientific research, which you want to take across to the audience and target it to them so that they will listen to it. So how would you tell a story here? So when you want to tell a story, then you start with an introduction. Before you go on to your introduction, look at your research question. The research question meaning, what is the primary focus of your thesis? Then 2 is, why is this important? 3 is, how does this work fit into the already existing academic platform in the context or in the field in which this work is fitting into? These are the 3 things you need to define when you're starting to write your thesis here. Then you would go on to what is, already obviously there, where you need not think much. It's your study design. It's your methodology. So these are already defined during your protocol. So it's just simply laying them out. And always remember, you need not use flamboyant English to put it down. It's just simple English, simple small sentences, and take what you want to say across to the reader so that they understand and there is no misconception. And this goes a long way in effective thesis writing here. Once you have completed this, then you would move on to the results section here. And in the results section, after narrating all that you have found out doing your materials and methods, you would want to analyze this. So that comes on in your discussion as to how your results compare to prior existing studies. And is your result adding on anything new to what is already existing in literature? So that's going to decide the place your manuscript is going to have when you're thinking about publishing it here. And finally, you would conclude, meaning you would summarize your entirety, and then you go on to write your abstract here. So this is in a nutshell, all that is expected out of you when you are going to do your thesis. So contents of a thesis is, I think you're all very familiar. You would have looked at the thesis work of all your seniors when you start writing it. So the body has a title page. It has details of your thesis guides and co-guides, anything else you want to add on. And then the next page is an acknowledgement where you would want to acknowledge all those who featured along with you in this journey of 1.5 to 2 years when you were completing your thesis work. The next page would be a table of contents with your page numbers, which says, suppose your reviewer wants to just read the conclusion, then he or she must be able to, after looking the contents, turn on to say page 25 or 26 or 35, so that you're able to guide your reviewer who's going to be reviewing your thesis to easily locate what he or she is going to look for. And the last section will be the section of annexures. And the annexures largely would comprise about documents which pertain to your ethics approval. If you're having a CTRI, meaning a clinical trial registry details, the clinical photographs pertaining to your case series, if it's a case series which you have done, the particular figures, tables, questionnaires, or anything as a general protocol which you have used or you have applied in your materials and methods which you would want your reader to be aware of. So that's what a thesis in entirety needs to be, how it needs to be configured here. So a few tips on each section of the writing. Before I move on, I would encourage all our younger ophthalmologists here, please feel free to stop me and ask me anything in between if you want me to, and if you feel something is not clear, I would be very happy to explain it further to you here. So introduction, what needs to figure in an introduction? Several of them do get stuck in the way they write the introduction, and I have seen this in many theses which I have reviewed, that your introduction does not pertain to what you are actually doing. So do not write it out like a review, or do not write it out like a book chapter. So what your introduction needs to be talking about is your topic of your thesis. So first look at your topic of the thesis and look at what is key in that topic of the thesis. For example, if I've given a thesis to my thesis candidate who's talking about corneal biomechanics in keratoplasty. So the topic here features two things here. It features corneal biomechanics and it features about keratoplasty. So your introduction is to pertain to a particular context which is linking biomechanics to keratoplasty, rather than writing pages on biomechanics and pages on keratoplasty. I don't say do not write about them, but write about briefly of what you want to say about keratoplasty, perhaps a paragraph or two. Then write an introduction of what you mean about corneal biomechanics. You define it, and then go ahead in your third section of your introduction to link your biomechanics to keratoplasty and tell them why you want to do a research in biomechanics, or what is the importance or the need to do a research in biomechanics. So that's how you need to frame your introduction, and not make it look like a chapter, or not make it look like something which would figure in a DOS Times or in a bulletin journal, which is just talking generally about a particular topic here. And then you would go about in your introduction to briefly elaborate the particular history of that topic here. What are the existing treatments in point-wise or in a few sentences? And if there are any newer modalities or newer approaches to this treatment. And this will directly lead you on to establish the context of your work. Meaning, for example, if I did say corneal biomechanics in keratoplasty, it will lead you on to tell the people, to tell your audience why you are looking at biomechanics in keratoplasty. And that establishes the context of your work and explains the importance of your thesis work to one who's reading about it. Sometimes it is easier to write an introduction. So this is something which I have experienced over time, and this is a pearl which I would extend on to our younger minds, is it's easy to write your introduction after you write your methodology and your results. Because in methodology, you're simply defining what you had done, And in results, you are elaborating each of the study parameters which you have mentioned in your methodology here. So you could go back to write your introduction in case you're confused, in case you're not clear in your mind, or if you've already written, you can go back and refine or modify your introduction and make it more crisp, and you will really find that once you read it after you've written your methodology and results, it really starts making sense here. So after your introduction, what you need to look at is a review of literature. And most of you, both guides and students, we would have all looked at our review of literature when we are allotting a topic to our candidate. And if you're a candidate, you would have definitely reviewed your literature in detail so that you are aware what exactly is existing in literature so far in that particular field of research. So again, I'll go back to the topic which I mentioned if I'm talking about corneal biomechanics in keratoplasty. So your key feeding in topic in your review of literature would be corneal biomechanics. So you would write about all the important topics of corneal biomechanics, which is featuring in literature till date regarding keratoplasty. So this helps you to gain a good knowledge on this particular field or this particular topic which you are focusing upon. It also helps you to understand by reading those literature, what is the methodology which is commonly adopted, or what is the methodology which is best suited to bring out good research in this particular topic of focus here. And then it also helps you to understand, is this research required? And this helps you to narrow down, meaning all these aspects A, B, C, D has already been done. So what is missing? Or what I tell my residents is, what is the lacunae in knowledge which is existing in this particular topic which you have chosen to focus upon. So this helps you to identify your research question. This helps you to frame your research hypothesis, and this helps you to define your study methodology. So if you just follow these simple tips, and if you just write out in these aspects, you would be going about your storytelling, your research storytelling in a very, very effective manner. And this forms the basis of how to start your study and how to make your writing more interesting to your reviewer. So these are very simple tips on review of literature, and this makes it most enjoyable. I find review of literature one of the most interesting aspects. It is a little time consuming, but it is something which really broadens your knowledge platform on the particular subject you're going to work upon, or you're going to elaborately write upon. So again, the emphasis on is write introduction after completing your methodology and results. And please look at review of literature elaborately. Please remember, if you have left out something in your review of literature, you might land up doing or framing your study, your question or your research hypothesis, which might be a duplication of what is already existing. And when you want to take it forward to publication, the first query which your reviewers of your manuscript would say or ask is, this has already been done. So what are you adding on? Or what extra is the reader going to get from what you are working on this thesis? So that this is what is the two quotient of thesis writing and manuscript writing, and this is how they differ, and this is how you would probably able to convert your thesis writing into a manuscript writing for a journal here. So when you go about discussion about the previous literature on the subject, so in review of literature, you discuss on the previous literature on the subject. You look at the historical basis of the particular topic which you are talking about, and don't go in detail, but something which is brief and to the context which would be relevant. Then studies similar to what you are looking at here, and studies which are refuting and contradicting your research hypothesis also need to be discussed here. And always remember, rather than quoting textbooks, it's good to quote journals, primary research journals and journals of importance. In the last 5 or 10 years, that would help you to define what you are writing here. So once you've done this, it's taken you on to the next step, which is identifying the lacunae in knowledge or the gap in knowledge. So you've reviewed the literature, and once you've looked at all the literature, you have seen, okay, this aspect is not defined, or this aspect is something which is not yet understood. So let me research upon this. So that helps you to define your research subject. It identifies the gap in the knowledge which you have, and thereby you can frame your research question, and you can move on to justify why this research is needed and what is going to be the importance of this research in adding on to data which is already existing in literature over this. So remember to follow your review of literature with a lacunae in knowledge, with a research question, and with a justification for the research study. So that's how you come this far before you go on to your materials and methods here. Before you write your material and methods, what you need to define is the objectives of the study. Meaning, once you have already defined that this is the lacunae in knowledge, and this is going to be my research question, this is the hypothesis which I'm framing to say, to look at my research question, then you elaborate your objectives. Objectives meaning, what am I aiming to find out when I'm doing this particular research? That's the simple thing. So think in your head again, what do these objectives mean? And you can categorize these objectives into primary objectives and secondary objectives. That makes it much simpler for you to understand your study, and it also helps your reviewer to understand what you're trying to find out, and are your research methods or the material methods apt to your primary and your secondary objectives here. See, the objectives need to be well defined before you start your methodology here. So from here, we move on to methodology. So we've written the introduction, we've written review of literature, we have looked at the lacunae in knowledge, we have framed our research question, we've defined or written down the research hypothesis here, and we've also looked at the objectives. And before the objectives, we justified why we have done this. We wanted to do this research, or why we have done this research. And now we are moving on after the objectives to the methodology. So in this slide sort of just tells you what all should be present in the materials and methods when you're writing it out. So if you follow this simple line, I think you will not miss out or leave out anything here. So in methodology, you will have to define or write out what your study design was. Was it a retrospective study? Was it a prospective study? Was it observational? Did you do any intervention? So these are the particular, was it a case control? Was it a cohort? So all these are aspects which you need to define in your study design, where your study was done. What was your study sample? So going back again to the example which I looked at, if I'm say corneal biomechanics and keratoplasty, my study sample is going to comprise of patients who have undergone keratoplasty. So that's what I mean by saying defining my study sample. Once I've defined my study sample, you probably also will want to elaborate. When I say keratoplasty, it doesn't mean that you'll have to say, am I talking about pediatric keratoplasty? Am I talking about adult keratoplasty, which means you define the age group. You'll talk about the types of keratoplasty if you're narrowing it down. You talk about the postoperative period the patient. So I would say I would look at keratoplasty patients between the age group of say 20 to 40 years who have undergone penetrating keratoplasty or lamellar keratoplasty with a minimum duration of over 3 months postoperative period. So that goes on to elaborately describe your study sample here. And then comes on, what are the number of patients you need to take for making your research meaningful? What do I mean by saying research meaningful? It has some statistical relevance. That's when your conclusions can really be extrapolated to a larger population and make sense. So you will have to define your sample size. So this is when I think you would have already met with your biostatistician, and you would look at your sample size calculation. I think I wouldn't go into the elaborating how you go about it, but it's always a good idea to write down how you did your sample size calculation, to talk about your alpha error in these here, and what is going to be your power, what was the power of your study. So these all add on a lot of value to the thesis writing when you are, and it also shows that the candidate has understood what he or she has been doing here. Again, on sample, define what are the cases which needs to be included and what are the cases which needs to be excluded. So I would say if I'm taking keratoplasty, I would say I will include all cases with a minimum 3 months postoperative period. So I will exclude all cases who are lesser than 3 months postoperative period. So that's something which you have already been detailed about with your by your guide. So these come into your inclusion and into your exclusion criteria. After you've defined this, you will move on to your examination techniques here. So what are the ocular examination techniques which you have done? So you have to just elaborate on these. What are the tests you use to achieve the objectives which you wanted to look at, which you wanted to derive at? And when any particular interventions done, those will have to be elaborated. If there are any particular protocols, if there are any questionnaires you have used, have you obtained permissions for using all these? So all these will have to be elaborated. And please remember to always state that the approval of your Institute Ethics Committee was obtained. Give the approval number and add on the copy of the approval in your annexures here. And if it was a clinical trial or drug trial or a particular surgical method which you are evaluating, then you should have applied and got a CTRI number. So that again, a document of that, and the number should also be given here. In study designs, also remember you would talk about randomization if you're doing an RCT. If you're doing drug trials, remember to mention if they are open label, closed label trials, blinded, double-blinded studies. All these add on a lot of importance and really elaborate to your reviewer or to the reader what all you have been doing so far here. And when you conclude your material and methods, you will have to state the statistical methods which you had used for analyzing your samples here and the p-value significance here. So here you will have to understand a lot about what is parametric data, what is non-parametric data, how is the distribution, is it a regular distribution or it is a skewed distribution? So this involves an understanding about your statistics, and a good understanding will help you to elaborate all these when you are writing down your materials and methods. So from here, I think we move on to the next is your results. Simply in your results, I think that this is a section in which many residents and I think even many thesis guides tend to make faults. And this is a section in which the manuscript also is faulty. In results, just remember, you will just have to state what you obtained of all the study parameters you mentioned in the materials and methods. That's just keep this in your mind, that the results of all your study parameters you mentioned in your materials and methods needs to be elaborated in a table form or in a text form in your manuscript or in your thesis paper. This is what is important. Do not add on anything which you have not mentioned that you will be doing in your materials and methods. So results is just a compilation of the data, of the raw data. You're categorizing it and you're presenting it in graphical forms. Again, the knowledge of your statistical methods helps you to depict them in good graphical forms. And please remember, when you're converting your thesis into manuscript, the effectivity of your graphics, it plays plays an important role in reaching out to your reviewers here. So that's important, and that's why you need to know a lot about your statistical methods here. So please remember and please see and discuss with your statistician, with your thesis guides, if the methods you have applied for your thesis analysis is meaningful, is correct, as your p-value interpretations right, because your conclusions and discussions are largely going to be based on what you're getting on your statistical analysis here. So that's very important, and this all needs to be stated in your results section here. So what all needs to figure in your thesis? Your master chart, the appropriate statistical tools which were used. Please remember to elaborate the mean and along with the standard deviation for every aspect of your study parameter. If there are a range for all those parameters and the significant p-value to say whether there is a statistical significance to this particular result you are getting after you've analyzed what you've got on your parameters here. And then you would categorize your results to cater to your primary and your secondary outcome measures. The use of tables, charts, graphics is something which I already mentioned, and I'm placing more emphasis on this. And this really makes your thesis look very interesting and also very appealing. Several times as reviewers, when we are reviewing thesis, we would probably not have the time to read your first 30-40 pages, and we would directly go on to your objectives and your results. So the way you write out your results, the clarity in which you have categorized and written your results goes a long way in creating a very positive impression about your work to your reviewers. Once this is done, you move on to the discussion. So what needs to be written in discussion is that you are going to discuss the existing literature in comparison, or you're going to discuss your work in comparison to the existing literature and see whether your work is in agreement or disagreement to the existing literature. What new have you added on by doing this research? And what are the new conclusions which you can get from your results here? And how can this, what is the clinical significance, or what is the application of this research? If you're doing a clinical research, you're going to look at what is its clinical significance in patient care, in surgical outcomes, in management modalities. If you've done a basic science or a translational research, you're going to look at how is this enhancing the understanding in this particular translational research, and is this paving a way or laying down a further platform to take it on to the next level of a translational or basic research. So this is what you need to discuss in your particular discussion here. So the conclusion template should have a topic sentence which reiterates the purpose of your paper. It should be a statement of your thesis here, a summary of the evidence of all that you have obtained on your thesis, the conclusion which you have derived from your results here, and then a conclusive statement to say that have you been able to prove your objectives and your primary and secondary objectives? Have you been able to come to a conclusion to your research hypothesis here? And are you able to recommend anything new based on what you have done? Always do remember, do highlight what were the shortcomings of your thesis. Any work cannot be 100% perfect. So remember, there will always be shortcomings in what we have done. And it's always wise to point out your shortcomings so that a person who's reading and who's going to base his or her work on what you have done is aware of how to go about these shortcomings and correct these shortcomings and better his or her work based on what you have done here. So this is in a nutshell all that you will need to write out when you're writing your thesis here. Remember, your reference writing is important. The references you quote will have to be of particular value to the work. So the way you choose to cite your references is very important. The style which of referencing should be uniform. It should be numbered according to the serial order in which you are quoting your references here. Sometimes you can take the help of, you have Zotero, I think, which most of our residents use. And these are applications which help you to easily number your references. And that's a simple tip, so that if you're adding something, say in number 21, after you felt that this has been missed and you've written down 100 references, adding on 21, the document automatically renumbers all your references throughout your text, and it makes it easier, saves a lot of time, a lot of headache, and you do not get tired doing your references here. So that's very important. In Access, I've already told you. Please do remember, several times I do find in thesis which I am reviewing that the students do forget to or miss out adding on their patient information sheets, their informed consent forms. Your informed consent forms will have to pertain to, adult patients, pediatric patients, legal guardians, controls. And so these will be all different forms. Of course, I'm sure your ethics committee does look at it in detail and ask for all these forms. So these forms would definitely be lying with you, and you would have filled them for all your cases. Do remember to put a copy of these forms in your annexure so that your reviewer is aware that you're aware of all this and you have looked at all this. The investigator brochure is nothing but the simple patient proforma which you have used for filling down the details of each patient when you're recruiting. So a copy of that should also be put in along with your Institute Ethics approval and the CTRI details here. So with this, I think I've completed in a nutshell what all needs to be figuring when you're writing your thesis. So I've just put it forward in simple words. And if you just follow this framework, and if you just look at each of these as your subheading, I think your thesis writing would be just very simple. You would not miss any of your points. And it also makes it very, very easy to convert your thesis into a manuscript for your journal, depending upon the journal which you have shortlisted. I think I have exhausted my time here, and I wouldn't want to elaborate it more because thesis writing is always a dry topic. I will again re-emphasize on what I told you. Enjoy doing your thesis. Don't do your thesis as a work to make your thesis guide happy, but remember it's part of a fulfillment of your master's degree here, and you would want to do it as a methodology for as a part of your completement. So I'll just run you through a thesis example just in the next 2 minutes here. This is a thesis of one of my candidates here. So just to see how we look at several times, I think this is the first research manuscript you're writing. So you're not really aware of how to format your Word document here. You could take professional help in doing that. Just remember, this is the first page, which is a title page. It has your college's logo onto it, and it gives you the detail of the thesis submitted to the faculty of which institute as a partial fulfillment of the requirement of your master's degree, the time period, the day, the place, and the name of the candidate is here. And next comes the page, which is the certification. And this is something I always tell all my residents, please keep an extra copy of this paper and put it as your first. I felt very proud to put my thesis certificate, and I still keep it as my first certificate in my file, which carries all my certifications. And wherever you go, this is the first certificate where you would say that this is the first research I have done, and it carries the signatures of all your guides and co-guides, and keep a copy of it for yourself, for your memory as well, and as in your file. The acknowledgement comes on after that, the abbreviations which you've used throughout your thesis here. This is the content index with all the page numbers, the elaboration. So it talks about the introduction, the review of literature, the lacunae, the rationale of knowledge of study, the objectives, the methodology, results, discussion, everything which I just talked to you about in the last half an hour or so. And then you start writing out your thesis in the way which you feel would be appropriate to take your storytelling and make it interesting to those who are reading it. So the length of your document would depend upon the importance or the relevance or the number of articles which are already existing here. So I think I'll stop here, and I thank the entire team here for having me on your prestigious panel and giving me this wonderful opportunity to take across this thesis writing exercise in an effective manner. And I hope you all benefited from what I've told you over the last half an hour or so. Thank you so much.
So thank you very much, Madam Manti, for so nicely elaborating and explaining the details of thesis writing. I have just only one point to make, that for thesis writing, one must also learn MS Word actually. Because this formatting of the paragraphs, the pages, then indexing also can be done with MS Word automatically. If you use properly the MS Word for typing your thesis, most of the things can be done very easily. So that when you do little changes, that will automatically be adjusted accordingly. That is one thing I wanted to highlight. The rest now the topic is open for discussions.
Yes.
They can ask if they have any questions, any doubts to be clarified.
And I would like to ask one question.
Yes.
Is there any specificity like in the number of pages? Should their thesis be within 60 to 80 pages or 100 pages or anything like that?
See, what's important is that your thesis contains all the relevant data depending on your discussion topic or the topic which you have chosen. So if it's an elaborate, if it's something like, I'll go back to corneal biomechanics, then in corneal biomechanics, it's a relevantly new topic which is figuring only over the last 5 years or so. And so you would probably not be able to write down 200 pages on that thesis. But if you're talking about, say, intraocular pressure measurement in keratoplasty, intraocular pressure is something which is there for ages together. So you will probably have to root it out and see what is relevant data in this particular topic, which needs to be figuring in your thesis. So that I think is largely defined by your thesis candidate, by your thesis guide here, and you could discuss it out to see how elaborate you would want to. Again, I've seen a lot of people, if it's intraocular pressure and keratoplasty, I do not want to keep reading about Shear tonometry and non-contact tonometry. So it's an MD thesis or a master's thesis you're writing. So write on parts which on a little advanced level, and you don't need to take it to the real basic thing like you're writing for a first year student. So that in a large way will take out a lot of unwanted data in your thesis writing and make it more interesting and relevant. I think that answers your question.
Yes, thanks.
Yeah.
Dr. Prafula, your comments?
Thank you, ma'am, for the wonderful talk. I think ma'am could cover all the aspects of a thesis writing. So I'll just add few points, not add, but I'll highlight few practical problems that may help the discussion.
Mm-hmm.
First of all, when you're writing thesis, it's a very heavy document. And almost all of us must have come across few of the students, they say, thesis dikhao, they will say, sir, laptop crash kar gaya. So initially we thought the person may be cheating or lying, but actually this happens because you put so many charts, so many photographs in one document. It's very likely that something may happen to your laptop. So always please keep a copy in a CD as well as in a pen drive, whatever you are doing. That is first. Second, this happened to me also. I'll send my thesis to one co-guide, then that co-guide will do some correction, then the chief guide will do some correction, then one of the SR will do some correction. In the end, when you are going to print, you don't know which one is your final one. So in my thesis printing, that computer guy, he printed the last but one version. Then I had to reprint all the. So when you're typing or when you're making correction, please give a date to the document. Yes. Draft 1 date, draft 2 date. So that will help you in that. And second, referencing. Ma'am rightly said it's very useful to use automatic referencing tools, because in that way your sequence may not change. Because I had one of my colleague whose thesis came back because the thesis references were not in order. So that is a problem that your automatic referencing tool that they can take care of. And as ma'am said, this is your first research project, and probably it will be your first publication also. So be serious about that, and don't take it as a burden, and just enjoy that. And I think there is a question related to that. If it is mandatory to publish your thesis, it's not mandatory, but what I would tell you from my experiences, I must have appeared in almost 9 interviews after my senior residency. And in all the 9 interviews, there will be a question that, okay, what was your thesis and have you published it somewhere? So if you could publish your thesis work, it sends a very good message to the examiner or maybe the whoever taking your interview that, okay, this guy has done a good research during the MD. So that sends a very good message about your work. So you should try to publish your thesis. And the second question is whether to publish it in fully or partly. Ma'am, I think you may answer that. Is it necessary to publish the complete thesis in one paper, or can we publish a part of it?
Okay. I think I'll talk to this. I'll address this in two contexts, Praful. When I was editor of Delhi Journal of Ophthalmology, and we did have a special drive inviting residents to send in their thesis for publication. And you would be surprised to see a week after, when I woke up and opened the website with the submissions, there were candidates who submitted their entire PDF thesis. Okay. So then okay. And I was a little amazed to see that. And I wouldn't blame them, because they probably did not understand the context of, the call which went for it. So when you say the call going out requesting for your thesis papers, Delhi Journal of Ophthalmology is not indexed in PubMed. So it comes under a non-indexed publication. So we do call out for most of the theses where they feel it's not going to be going into a indexed journal here. So that's the first thing you need to understand when you publish your thesis. Probably what they mean is, should I send the entire PDF document? That is not what is required when you have to send in. When you're writing your introduction for your thesis, for a MD thesis, your introduction will probably run into 7 or 8 pages or 10 pages, depending upon your topic here. But when you're writing for a journal, I think you will have to learn to look at the instructions for the journal. The journal usually defines what is going to be the particular word limit for the original article here. So you have to make your introduction more concise. It has to be dot on to the topic you're writing. So probably if you've written a 7 pages introduction, you're probably going to narrow it down to 2 paragraphs in your introduction. And that needs to be really important and well written, because that is what is going to make or convince your reviewer to read your manuscript further and see that your thoughts are coherent. So when you say manuscript writing, it doesn't mean you write your entire 100 pages and send it for your publication. You will have to tailor it and modify it to the requirements of the journal. The second context is probably you meaning, can I get 2 papers out of the thesis work which I have done here? Okay, again, getting 2 papers, which means probably you want to separate your primary objective and your secondary objective and publish it at 2 different works here. That is possible if your primary and secondary carry a lot of weightage on its own. But if your secondary and primary are heavily correlated or interrelated, then it might not be meaningful publishing them separately. So it's going to largely depend upon the context or your topic of focus, depending on which you could decide. I think your thesis guide will be the best person to guide you in telling you whether it can go in as 2 papers or it can go in as 1 paper.
One more point about the number of pages. Dr. Pushpa has written DNB recommends only 80 pages. So this is what I would say. At AIMS, we don't have a page limit.
Yes.
But it's better to do it in 80 to 100 pages, or else the external reviewer, they will get bored after seeing that voluminous thesis.
Yes. And there's some...
Yeah.
Sorry, Praful, to interrupt you. There's
so
something
all the university, they have their own recommendations.
Yes. So look at the guidelines.
Yeah.
And also, I think I have seen reviews where the font size is 14 and 16. Okay. So to make it look like your thesis is voluminous. So don't resort to such shortcuts to make your thesis look larger. I think the reviewer is wise enough to judge the importance of your thesis based on the context of what you've written rather than the volume of your work here. It can be just 40 pages, but your work can still be exclusive here. And the standard font size which we look at is 11 or 12. 12 is what something. So don't go beyond 12 and don't say send it in 14 and 16 and make it double spaced or more. If it is larger, if you have more, you could always use a 1.5 format, your spacing here. So that is where your knowledge about handling word formatting really helps to make a very good presentation of your work. And that's equally important to it's as much as important as the importance of the subject which you have chosen to work upon.
Thank you, ma'am. One more question is there in the chat section. from Dr. Anita Misra. I think this point we discussed in last meeting also, but I think ma'am you can further elaborate that this time. Will it be salami slicing if I publish in two separate journals separately on primary and secondary objectives?
I think we already talked about this, Praful. It depends upon the strength of your primary and your secondary objectives. Sometimes the amount of data you have on your primary could be voluminous enough to publish it as a separate one, and the data you have on your secondary could be voluminous enough to publish it. And if you put both together, the thesis would be too heavy, or the manuscript would be too heavy. And again, the reviewers of the journal will feel there's too much data on it. I don't want to accept this, and they'll send it back to you, not only for lack of data, but your manuscript does come back for too much data as well. So that's something which is going to be hugely needs to be guided by your thesis guides.
One more question is there, ma'am. What is the minimum sample size for a thesis?
So I think statistical significance, that's the basis of doing any work here, that you need to look at your talk with your biostatistician. So how do you think about what is required? So you look at the quantum of change you are measuring in any particular study which you are doing. And depending on that quantum of change and how it is being defined in the prior studies, your biostatistician is going to ask you for certain data based on which he calculates what is going to be your sample size. He also takes out your alpha error and a power of study for this many study subjects, this many study subjects. You also put in or given allowances for patient dropouts, which you all come in. And you will also look at in your particular setup, how many patients are you seeing in a particular year on this particular disease. So this is a particular exercise which is done on its own when you are going to sit and do a sample calculation. For statistical significance, it's going to depend upon the quantum which you're defining in your objective. So I think you can't sort of lay it out as a blanket, but if you're looking at laying it out bracket on layman's terms, you would look at a 33 plus or a 35 in a particular group if you're looking at statistical significance. But that I would say is a very, very layman way of looking at biostatistics. And any statistician, if I say this, is going to think I'm really stupid.
It's always better to consult a statistician before you start a project. Why? Because a lot of students, they have a concept that it's only in RCT or randomized clinical trial that you need to calculate the sample.
No.
That's not true. For any study, you can calculate the sample prior to planning the study. Then you will not have that much difficulty while publishing the thesis. I think, sir, Subudhi said all the questions are over. We could, ma'am has addressed all.
Let us hear from Dr. Chandra, madam. Dr. Chandra, do you have?
I think we have a list of panelists. We should go to them.
Yeah.
Let's see what they want to add. Let's see, and then we'll.
Dr. Ruma wants to say something. They are muted.
So, Dr. Banoti, it was a very nice and informative presentation. Thank you so much. So, I want to add one thing: period of study. So, I think we have to mention the period of study.
Yes.
And one question to you means, what is the word limit, minimum and maximum word limit for writing a thesis?
Again, I think as we already said, you look at your guidelines in your particular university, which says, or your DNB saying that it needs to be this many pages. So if you're looking at, say, if you want 100 pages here, and you have a little more data than that, you know, on an A4 size.
Introduction, review of literature, and then all the...
See, we particularly do not have any word limit at AIMS when we are looking at a master's thesis. We only want all relevant information pertaining to that particular subject to be in there. You're looking at a word limit when you're looking at a manuscript writing. So roughly, if I say if an introduction needs to be having 5,000 words, your subject might be vast that you might probably need to use 7,000 words to cover it. So I would still say it needs to be according to the subject which you are defining. And if you have limitations like your DNB thesis saying 80 to 100 pages, then you probably will put in only the salient features in your introduction.
Thank you. Next, any other panelists want to add anything or want to discuss anything?
And
Any of our panelists, please?
I think we should invite the postgraduates also, postgraduates. Do they have any doubts? No doubts?
Panelists want to give any input?
So can I, hello sir, good afternoon sir.
That's Suchita, yes.
Yeah, Dr. Vanith, it was a wonderful presentation and very precisely said. I just want to add this much that this PG thesis writing, it should be involving from the beginning. Like protocol writing, they start and then they forget everything, they do it, and then towards the end, they are in a hurry to finish up their thesis. It should not be the thing, and they should be inculcated from the beginning to start writing. So they should have a scheduled plan, and they should be planning accordingly which chapters to keep on writing. So initially, review of literature is the best to start with, and they will get a knowledge about it. And as you said, methodology should be written because that is what they are doing. And at the last, introduction should be written, and results, whatever they are getting, whether it's a positive or even a negative significance, they should put it on. Because sometimes they say, my thesis did not have any significance, nothing relevant came out of it, what I'm going to do. So, but anything your study is doing will have some significance if you keep on studying and do it. And it's indeed a stressful thing, but if it is done in a systematic manner, it will be indeed pleasurable, and finally that can go into publication. That's all to add.
Yes, Dr. Suchita, I completely agree with you here. And I think a well-written protocol, by the time you're finishing your protocol, if it's well written, up to your review of literature, material methods, and your research hypothesis, everything is already written here. I tell my students always, I think PubMed has this section where you can, I think, save your searches here. You can put in your keywords, and you can also record, you can connect it to your email. So whenever a new article is appearing on those keywords, there is an email alert which comes to your email. Then you can go back and read it, see if it is relevant for your thesis. And if it's relevant, you can keep adding it on to your review of literature. So the review of literature writing is the most voluminous part of your thesis writing. And that tires them out. And if they are doing it throughout this 1 year or 1.5 year period, they're doing their thesis, it's very easy, and it becomes very pleasurable, and it also keeps updating them on what is appearing in their study. And it can, in a way, if halfway through your thesis you feel that you want to add on a modification, then you can do it, and you can write to your ethics committee and saying, I would like to add on a modification, I would like to add on this aspect, or I would like to, particularly modify your parameter of your study, and to make your study a little more meaningful than what it was when you started off in the beginning. And yes, defining your study period is very important when you're doing your thesis work. That largely limits several times the power of our study, given that the follow-up is going to be only 3 months or 6 months. So it's something which can be discussed as a limitation, and definitely it helps when you define your study period. A simple method is, I always tell my residents, please keep your data properly, keep your contact details of your patients properly. You could always extend it on a 3 months follow-up to a 6 months follow-up, or a 9 months or a 1 year follow-up, if you want to increase the value or the platform of your results when you're presenting.
Thank you. Thank you, Bhavanti. So if anyone have got any things to discuss, any panelists left?
I think there are two new questions, ma'am. Dr. Anita Misra, actually, I'm not able to understand what you want to ask. The question is, can I use a thesis work which is granted but not published in a meta-analysis? The question is a bit confusing.
I think she means that...
You can unmute and ask yourself.
Yeah.
You can.
Yeah, hello, doctor.
Yes.
Am I audible? Yeah.
Yes, ma'am.
I just wanted to ask that we have got a thesis which has been completed around 5 years back, but it has not been published. and I want to do a say cross-sectional observational study of this same duration and around the using the same study population again to see what are the changes. So can I use that thesis as a parameter for my meta-analysis?
Okay, if you're doing
that has not been published, but it is a complete thesis. It has been completed, say 5 years back.
Yes. So from your question, I think you want to do a phase 2 study on your data which you already have five years ago.
Yes, ma'am.
When you're saying meta-analysis, I think you're doing a meta-analysis for publishing in an index journal. That's my understanding.
Yes,
so when you want to publish in an index journal, I think the first thing is you will have to define your methodology of how you're going to do your meta-analysis. And meta-analysis, the studies which you select should be peer-reviewed publications. So if your thesis is not published, it's not a peer-reviewed publication. Okay, that's point one. Suppose you want to do a phase 2 study, or based on the data you have obtained from your phase 1 study, you could probably do it for your next thesis, but it will only be accepted for your local area, or it will only be accepted for by your own university, but it will not be largely accepted in a indexed journal media.
Yes, ma'am. Yes, ma'am. I got it. Thank you.
Okay.
Yeah.
So another important thing, I think, plagiarism. While writing a thesis, finally, at the end of your work, then plagiarism is a very important question and issue, actually. So that should, all the PGs, they should be very careful not to be involved in plagiarism. Because you should know that there's reviewers, many of the reviewers, they are actually ready to use a software, and they just check it whether you have done any plagiarism or not. You have copied, just copy paste or not. So that should be very carefully, you should avoid writing the thesis. And regarding this pages of thesis, yes, I think Bhanati has told that rightly, but I have few things to add, because this number of pages many times. So what I am saying is that some pages, they are the binding, they have done almost 200, 250 pages like this. So we have to give them an idea in the beginning only, while they are doing it, that 60 to 70 pages, I think. What I say is that, and that is given in, if your university or your institute has not given any clear-cut thing about this number of pages, so you can restrict yourself by 60 to 70, maximum 80 pages. And while saying that, I must say that this font size, number of table, the reduplication of the, suppose a result, I have many times seen how they are increasing the number of the pages. The same result section, in the result section, they have written the result in as a text format, as a table, as a graphical representations. So that is not actually needed for writing. It will just heavy, make it a burden for the reviewer to review the thing. That is not needed actually. And while you are using this review of literature, as Bhanati told rightly, you should write it, the first review of literature from the beginning, only 15 to 20 pages. And this is the most important thing, 15 to 20 maximum means number of pages we invest for the review of literature will be the maximum. That will be the maximum. Introduction page, you can write 1 to 3 maximum, and that you can write, as you have already written your protocol, that time you have written these introduction, and or you can come back later after finishing your all this result discussion, then you can add on this introduction part some more. But not much. In this introduction, one should not use any graphics or any tables or any figures. There should not be anything, and maximum 6 to 10 references will go in the this introduction part. And what else? The reference writing, or it will be bibliography. In some of the institute, they said it is the reference or bibliography, but I think the list of references or references is a better term for this particular section. This is one. Then print paper. The paper should be, when you are first time, it should be a good quality paper, which is very thick, and it will be in laser printed. And from that first print out, you can do actually just copy. You can copy the other means number of binding you can do just by copying with this photocopy of that. You don't have to do repeatedly. If you do the first one very nicely, this printing. Then coming to the introduction writing, there are two ways of writing an introduction. You can, one is what Dr. Bhanati has told, that is the build-up introduction, build-up. That is, you first, when you are telling a story that these are the things are known to us, and finally you just narrow down that this was not known and we are going to do this. Or you can do just the reverse one, that is called the reverse pyramidal type. That also you can do while writing this introduction. You first start what you are going to do, and then you come to that what was done before, like this. That is also an accepted method of writing the introduction. And Bhanati, I think, will you say something about this, the title, making a title? Though title actually already in the protocol, you have written the title, you cannot change it. So you have to be very careful while you are submitting or writing the title. You should be careful that you will not miss anything, so that you don't have to go back and add something in your title or subtract something from your title. That is very important. And your title, remember that the title will be actually these keywords. If you just write these keywords, add these keywords, then your title will be completed more or less. And that will help the reviewer or in any journal, this thing in future to find out your, upload your thesis if you do this thing. And this is more or less, I think I have completed more or less. Anything?
Yes, Dr. Chandra, very valid points. And I think these are a lot of practical points as well, which would really help the candidates when they are when they're writing down the thesis. But I think the onus also lies upon us as teachers, because these are kids, and they have not written thesis or read research articles before. So I would still say that when we are correcting our, I do not allot my senior residents to look at the work of my candidates. I do it myself. And I think that it's a lot of interaction between your candidate and you, and that's when you do pass on a lot of your knowledge and your quality and your ethics down to your candidate here. And the onus is on the thesis guide to see that the adequacy of the written material is appropriate, and that itself will, he would not land up writing 150 pages. When you are correcting, you will know that this is all needs to be present in the introduction. This is all that needs to be present in the review of literature. So if it is done the right way, I think there'll be a lot of less stress both on the guide and on the candidate.
Thank you.
Any other panelists would like to say something? Dr. Amit? Professor Amit, would you like to say something?
Any problem in writing their thesis?
Dr. Pushpa?
I think she has written a question here. Recommendations to be in discussion or in conclusion. Dr. Pushpa Kumari has put this question in chat box.
So or it is written in a separate thing. Because in DNB protocol, you have to write recommendation or limitation in a separate heading.
Yes. It comes after.
But in general, it is recommended that you have to write recommendation within discussion and summary of recommendation in the conclusion.
Yes.
So there is some confusion. So can you clear it?
See, your recommendations we usually write after you have discussed your thesis.
Yes,
which means
yes.
you have compared your results with what is existing on literature, whether it is agreeing, which is not agreeing, it is adding on something new, it is of significance or not. And
Yes.
after you have described this, only then you can give recommendation based on your work. So we usually write it out as a separate subheading. It usually comes after your discussion.
Discussion. Okay. Thank you. Thank you.
Dr. Chaitra, your comments?
I think it's been extensively covered, sir, and with all the other doubts and inputs from the rest, I think we've done a thorough job of it. And thanks to Dr. Vanati for, I think she's meticulously covered each of it, and the inputs have made it even better. Thanks a lot. Nothing from my side. I think the ultimate aim, I think, is to convert it into a publication, because that stays, you know, in the so-called cloud for the rest of your life. The thesis is a hard copy, it's a printed material, but once you make it into a publication, it's there on PubMed forever and forever for people to refer to. So I think that should be our ultimate aim. Yes.
I think Dr. Chaitra, being an editor or in the editorial board, she's giving more importance in this, the aim of a thesis. But for me, what I feel is that is not our main aim of writing or doing a thesis, actually.
Not at all, ma'am. I'm not even saying that should be the aim.
First step. That is the first step. How you will, in your rest of your career, how you will do a research. That is the aim that we are teaching them. And
yes,
this is a
after the thesis,
you are whether you are going to publish it or not, that is a good byproduct, not
exactly
not our method.
Exactly. It can't be the only thing, because your thesis is more important for you to complete your degree. I'm not even discounting that fact, but I'm saying once a successful thesis is written, I think you should give it a more permanent shape in the in form of a publication. You can't discount that fact that you can't write the thesis.
Yes, publication has to be the objective of any research, because unless you publish, it is unethical. Said that it is unethical conducting a research, and if you are not going to publish, because you have taken consent from the people or from participants, that result what is coming out is to be published also.
No, unethical is not, I think, that is not the...
No, it is the way in which...
Dr. Sobhusachi, I think you can't just say that this is an unethical if you don't publish it.
No, it has to be. Because
anyway, that
with participants, with their consent, they have got also every right to know what has come out.
So, Santosh, your concluding remarks?
as Dr. Chaitra just told that everything is very elaborately covered. So nothing more to conclude, I think. We have covered all the topics and even went to like this point that whether it should be published or not. Yes, it has. See, both are correct, I think. Madam Chandana is telling that it is the first step to teach them how to do a research and how to write a research.
Yeah.
And at the same time, if it is converted into publication, it is definitely like icing on the cake. So both are correct.
No, the participants have the right to ask what is the outcome of
it should be well written, as well as that should be attempt to publish. As both the points have accepted. So I think we have covered most of the things, and all the doubts have been put and they have been answered. I think with this, our postgraduates definitely will have a definite more way to go. That's it.
Yeah. So I think we have covered everything. So I think we'll offer the vote of thanks. So before I offer the vote of thanks, I request Anmol, our host today, to play their video before you close. Mr. Anmol.
Sure, sir, sure.
Yeah. So this is today's platform is by Enter Pharmaceuticals. So they would like to show a video. Anmol, do you have a video?
Yes, sir, I am playing.
Yeah, please. On behalf of the EIZOC ORPI team, I would like to thank Professor Vanati for his wonderful talk. Very simplified manner, I think she taught all the postgraduates how to write a thesis. Really, it's a wonderful talk, and our panelists also interacted very well with the speaker. A lot of questions came in the chat box, which has been discussed very well. And our moderator, Prafulla, and Dr. Chandra, they've really done the wonderful comments. And of course, I must thank our mentor, Dr. Chaitra, who is all the while sitting to us in all our ORPI webinars. I thank Dr. Chaitra. And of course, I thank our office bearers of EIZOC who provided this platform. In a broader platform, I would say that initially we were in the limited to our state in Odisha. Now it has become broader to the almost all the EIZOC states. I thank our President, Secretary of EIZOC for giving us this opportunity. So it's a really wonderful program, and our aim is to continue this program till December, at least minimum. So I thank our co-coordinator, Dr. Santosh, is always with us, helping us. Not the least, our advisor, Dr. Ajit Babu, who could not join because of some issues with his network. And last but not the least is our Enter Pharmaceuticals, who are providing the platform every week. So I thank everybody and all the viewers who have joined today and enjoyed the session. We also learned a lot. So thank you once again, and to see you again next week, another webinar. Thank you very much. Good night.
Thank you.
The advice is to take the job of writing thesis little seriously.
Yes.
Thank you.
Thank you. Good night.
Thank you.
Thank you. Bye. Bye.
Good night to you all. Good night. Thank you all.
Thank you.